Good afternoon, everybody, and thank you for joining us today for this virtual press conference. A couple of housekeeping things. First, we'll go through our speakers. Everyone except the speaker is muted. When we get to questions, we'll unmute everyone, but we ask that everyone keep their phones on mute if you aren't speaking. As you all know, COVID-19 is presenting a number of serious challenges to our community and communities around the country and world. Our immediate goal as a city is to working to meet the basic needs of our residents, like food and shelter. Our homeless neighbors are amongst our most vulnerable. Our shelters are not built for proper social distancing, a key to slowing the spread of COVID-19 in our community. And we've engaged many partners in this effort, and they have responded in incredible examples of the spirit of Columbus and Columbus Way, where our collaboration and partnership in working together to meet the needs of our residents has been on incredible display in many different ways. The YMCA, for example, turned its Long Street building into an additional men's shelter to allow for appropriate social distancing. Today, we are opening a new shelter to house men and women who have tested positive for COVID-19 or are diagnosed with symptoms of COVID-19 and need to be quarantined or isolated. The individuals in this shelter do not require hospitalization. In a few moments, Michelle Heritage from the Community Shelter Board and Tony Collins from the YMCA will talk about the details of this shelter. I want to let you know that we will not be disclosing the location of the shelter to protect the privacy of our neighbors. But I want to thank all of the public and private nonprofit entities that made this swift action possible. What we are doing today has never been tried in Columbus because we've never faced a global pandemic quite like this either. We must work quickly, but we also must remain nimble to adjust to the evolving challenges. I would like to invite Council President Hardin to say a few words, and want to thank him personally, both he and his colleagues, because it was their thoughtful and bold action when they last met to set aside, money as part of the city's COVID-19 response, knowing that these needs and other needs would be coming forward in the coming weeks and months. And I just want to acknowledge President Hardin and his colleagues for their commitment to serving the most vulnerable in our community during this crisis. President Hardin?
Thank you, Mayor, and thank you for your leadership. Hope you can hear me all right. Um, 2 weeks ago, Council passed a resolution that not only put forward our values about supporting working families and our most vulnerable, but also to formalize and make clear our support for our mayor, Mayor Ginther, in utilizing emergency powers to keep Columbus residents safe. In doing so, I want to shout out just a couple of my colleagues who specifically worked on this. Our housing chair, Shayla Favor, Health and Human Services chair, Priscilla Tyson, and our finance chair, Elizabeth Brown. At that meeting, council also created this $1 million emergency fund to address the critical needs in the community. Preparing for and responding for COVID-19 requires bold and decisive action. This fund was set up to ensure that we had the resources in position so that we could deploy resources with speed. We acknowledged then and we acknowledge now that $1 million from the city government is not the end of what will be needed, but the beginning. So, over the past 2 weeks, since we set up the fund, we've monitored emergency housing needs in our city through collaboration with public partners as well as nonprofit and private organizations. We see the clear need and the needs that will come in the future. That's why the $1 million from the council initiated emergency fund will be deployed to ensure these individuals experiencing homelessness can safely quarantine during corona outbreak. At times like this, it's critical to stack hands and make bold investments that protect our most vulnerable in our community. And we know that folks experiencing homelessness are particularly vulnerable during this outbreak. There are so many needs in the community right now, from businesses to nonprofits and from our residents. We will be there. We will listen. We will do all that we can to support the firefighters, first responders, healthcare workers, and all those who are joining us in stacking hands to fight this virus. I think all of us on this call understand that this situation is ongoing and will continue to progress, that we are at the beginning. But we're all committed to working alongside the mayor and all of the partners to support Columbus in our recovery. I know I speak for my colleagues when I say that we are all humbled to serve at this moment. Council will continue to support our public health officials and get good information out into the community. The emergency fund was just the start, and we have a long way to go. With that, thank you so much, Mayor, for your leadership and all those who are working to keep Columbus safe.
Thank you, President Hardin. We appreciate all the work from City Council during these challenging times. Next, I'd like to invite Michelle Heritage of the Community Shelter Board to tell us a little more about the shelter and the need that she is already seeing in the community from folks needing emergency housing. Michelle?
Absolutely. First, thank you, Mayor Ginther, for hosting this press conference. And I want to thank you, specifically, Mayor, and your staff and City Council. We could not be getting done what we are getting done so quickly without you side by side with us every step of the way. You have made the connections, you stood with us, helped us with resources, getting other systems involved. Also want to do a shout out to the YMCA, who is undergoing heroic efforts right now to really truly save people's lives, both those experiencing homelessness and folks in the community. And Dr. Roberts of the Columbus Health Department and the Medical Reserve Corps, again, partnering arm in arm with us. We're all trying to put something together, to your point, Mayor Ginther, that we've never done before. And we are racing against time. It's essential that these shelters get stood up right away. Right now, we're working on two critical paths. The first critical path is the social distancing path. None of our current shelters have been set up to be compliant with what the CDC recommends in terms of distancing and keeping people safe. So we are opening new shelters, which will allow our current shelter array to have social distancing so that we can make sure we are slowing the spread of this infection to the greatest extent possible. The second critical path is for those who are experiencing homelessness who do have COVID positive tests, they're awaiting results, or they are showing COVID symptoms. and also those who are experiencing homelessness that have been exposed to people who are COVID positive and they need to be quarantined. The shelter that we're opening today is the first among a few that we will open. Anywhere from 2 or 3 additional may be needed, depending on what's happening with this pandemic. And it is to keep single men and women and families safe, whether they need isolation or quarantine. We're working directly with the Medical Service Corps to provide us with medical interventions with nursing, telemedicine, and Dr. Roberts has got the health department arm in arm with us to do that. In addition, the Franklin County Adam Board and others are working with us to meet the behavioral health and other needs of these individuals and families that will need this service.
Thank you, Michelle, for all of your ongoing work and a Herculean effort on behalf of you and your team and all of our partners to put us in position to do our very best to protect the health and safety of some of our most vulnerable neighbors. Tony Collins from the YMCA is also here to talk about the Y's role in this effort, an incredible partner to the city and the Shelter Board and the entire community. Tony?
Thank you, Mayor. And I echo Michelle's comments. Thank you to you and your leadership and your team for helping and supporting in this effort. Thank you, Council President Harden, for all of Council's support in this effort. We obviously could not be doing this without your support and your leadership. I also want to thank Michelle and the Community Shelter Board, all of their staff and team. We by far are equipped and resourced right now because of the Community Shelter Board's efforts and their collaborative way of bringing all of our partners together to make sure this type of an effort pulls off. From a YMCA perspective, Mayor, you know, for the last 160 years, this YMCA of Central Ohio has been doing our best to serve the community as we can. Ever-changing needs happen, and this is an example of how we're pivoting to make sure that the Y is here to help with the rapid and severe impacts that this virus is having on our quality of life, our health and wellness, and our safety here in Columbus and in our neighborhoods. We're pivoting our resources to make sure that we can provide service to the community and those who are most impacted and vulnerable. While our family wellness centers are closed right now temporarily, we're still asking our members to invest. We're asking our community and our members to invest in this effort to help stand up and support this crisis response, as well as to make sure our nonprofits are here to sustain beyond this effort. The YMCA will focus our efforts right now in pandemic response, first and foremost on our shelter and housing efforts, which I'll talk about here in a second. We're also standing up pandemic childcare sites, working with our community partners like the Mid-Ohio Collective to help distribute food at some of our centers, and even providing auxiliary fire stations for some folks in our community. So working everything we can do to help support our neighbors and our cities that we serve. But today's purpose is to focus on the shelter and the housing, and I just want to talk a little bit about that. Today, I'm just so proud of our team members and our shelter and permanent housing team. They're always been on the front line serving the most in need. Every day we serve 1,800 people, whether it's at our emergency rescue shelter at Van Buren or in our permanent supportive housing complex throughout the city. And these folks have stepped up again to help provide emergency shelter. In this case, Community Shelter Board came to us. Our team said, yes, how can we help? And they've stood up the emergency shelter at Long Street to house an additional 200 folks. We're working with the Community Shelter Board to continue that effort, both on those paths that Michelle mentioned earlier. Today, as you know, we will also help stand up and open up this afternoon the SIQ shelter. Again, our team stepping forward and volunteering to be on the front lines to help support those most in need. And proud that the YMCA can be a part of that effort, and thankful that we're part of the team in doing this. As a part of that, I have to say as well, I want to thank Mid-Ohio Collective for all their efforts in helping provide food for our shelters. I want to thank Columbus Public Health and Franklin County Public Health and our entire medical team, including our volunteer team that helps guiding us through this. They're also critical in this effort. We couldn't do it without their support. So thank you again, and we'll continue to work this effort and be here for the community as we can going forward through this crisis.
Thank you, Tony, and appreciate all of the WISE continued partnership and work. We're going to get ready to move into taking questions from the media that have joined us today, but we have three other guests that are here that could talk a little bit more about the details and may respond to some of those questions. But because we have them, I do want to offer them an opportunity to say a few words. Dr. Mashika Roberts, our health commissioner for the city of Columbus, Joe Mazzola from Franklin County Public Health, and Matt Habash from the Mid-Ohio Food Bank. Wanted to at least give them an opportunity to say a few words about this work and what they've been focused on in helping us get to this point with this new housing for some of our neighbors. Dr. Roberts?
Oh, there he is. He's in.
Go to Joe, who leads our Franklin County Public Health. And Joe, I think one of the things that's going to be a critical part to this solution is the use of the medical, is it the Medical Reserve Corps? Am I saying that correctly? And can you talk about your activation of that corps and how they're going to be part of this solution?
Sure. Good afternoon, Mayor Ginther. And want to start by thanking all of you on this call. I want to thank the Columbus Shelter Board, Columbus Public Health, the City of Columbus, and the YMCA of Central Ohio, the Franklin County Board of Commissioners. We really appreciate all of your support and partnership here. So as part of the planning team, Franklin County Public Health really appreciates being able to be a part of this team, providing public health guidance. But as you mentioned, specifically engaging the Franklin County and Columbus Medical Reserve Corps volunteers, or how we like to say MRC for short. So in collaboration with Columbus Public Health, Franklin County Public Health coordinates our MRC program, which is dedicated to establishing teams of local volunteer, medical, public health, and other professionals to contribute their skills and expertise during times of disaster and public health emergency. And right now we have 968 active volunteers registered in our MRC program. So in support of this specific initiative that we're talking about this afternoon, we sent out a request to our MRC volunteers to help. And as they always do, they have certainly responded. We have 20 volunteers through our MRC that have stepped up and are ready to start work. And beginning tomorrow at 7 a.m., they are scheduled to start 8-hour shifts helping with some very specific activities. First, our medical volunteers will take temperatures with no-touch thermometers as individuals come into the shelter, and also kind of do a brief overview with them as to what they can expect when they get to their room. And then from the non-medical side, our non-medical volunteers will perform various housekeeping and operational tasks that will support the shelter as well. So we're so thankful for those volunteers who've already stepped up to help us with this effort. And certainly safety of our MRC volunteers is very, very important. So we will be following all of the CDC guidelines regarding personal protective equipment to keep all of our volunteers safe as well. We still do need some additional volunteers to staff additional shifts. And of course, as our COVID-19 response as a community continues to expand, there will be more opportunities for volunteers. So just want to make sure that I mention that if folks are interested in signing up to become an MRC volunteer, they can go to myfcph.org, or they can go to volunteermrc.org for additional information. So again, we certainly appreciate being a part of this collaborative. Our MRC volunteers have always been such a great resource for this community. We appreciate being a part of this initiative and our community's response to the COVID-19 pandemic. So thank you so much for this opportunity.
Joe, thank you, and grateful to you and the Corps. What another great example of kind of the Columbus way, the spirit of Columbus, of folks raising their hand and getting involved to help protect the health and safety of the collective community, and especially these folks who are most vulnerable in this crisis right now. Dr. Roberts, I think we have you back. Would you like to make any comments?
Sure. Thank you, Mayor Ginther. Apologies for that. We have some technical difficulties. Columbus Public Health has been happy to work with the Community Shelter Board, the YMCA, Franklin County Public Health, as well as the MRC to help provide these needed services to our community's most vulnerable individuals. So we're very pleased that there'll be a safe place for our homeless population to recover from COVID-19, as well as if they were exposed to someone with COVID-19, they could be housed safely and be monitored. So we will be providing with a nurse to provide some clinical guidance, as well as some screening of individuals who are housed at this new facility. But happy to be a part of the team and happy to help and provide any expertise we can. Thank you.
Thank you, Dr. Roberts. And so we've talked shelter, we've talked health, and we're blessed in this community to have one of the greatest advocates and resources around food security in the country. And want to ask Matt Habash to share a few words about Mid-Ohio's work in this effort and during this crisis, dealing with issues of food insecurity for folks in the community. Matt?
Thank you, Mayor Ginther, and to Council President Shannon Hardin as well. For us, this has been, a wonderful opportunity to continue the strong partnership we've had with the Community Shelter Board for a very long time. When they needed to expand, we said we had the opportunity because we were not cooking as many after-school meals as we were doing with some of our sites being closed. So we're now, I think, upwards of 10,000 meals that we've already produced for the residents of the current YMCA, as well as the new residents of the YMCA. So with this expansion, we're actually going to partner with one of our catering companies, two caterers, who's done great work and has a wonderful restaurant. They wanted to step up and volunteer, and so we're providing them with the food. We're buying the food. They have access to all of our food resources, and they're going to prepare the meals and deliver them to the sites. So with that private-public partnership, I believe we can take care of the food needs. The last thing we need any of the sheltering folks doing is worrying about food. Just to give you a sense of where we are, we're running about 25 to 30% higher in terms of all of the food distribution. Our pantry here at the food bank is about 225% over what it normally does. We're blessed to have 100 National Guard helping us, and we have ordered already $1.3 million of food to tie us over until we hope the federal food starts to show up, what we think is going to take 60 to 90 days. We may need to bring in even more. Fortunately, we're finding it. We even found toilet paper. So some things are, it's in Spanish, but we figure most people know how to use that. So, but right now, I mean, most of our agencies are open. Our biggest partners are doing tremendous work. We're gearing up for if we have to go into even more of a scale back, because our volunteers, as you know, most of our volunteers in some of our pantries are senior citizens, and we want them staying home and being protected. So we're monitoring every site in the county. But so far, all of our large ones and most of our pantries are still open.
Thank you so much, Matt, for all of the great work of you and your team, especially during this crisis. We're going to open it up to questions, which means we're going to turn off the mute all. Please mute your phones if you are not speaking. Remember, in addition to those, that we've heard from, if you want to specifically ask your question to a particular speaker, that's fine, or we can do our very best to field those questions if they're more general in nature. But if you could identify yourself and your news organization, we'd be happy to take your questions at this point.
Yeah, this is Mark Saranchik with the Dispatch. Can you hear me?
You can speak up just a little bit, Mark.
Someone is not on mute.
Not on mute.
Doesn't matter. It always. I don't know. This place looks pretty good.
Jason's Deli is open too if you want to go.
Yeah, I'm just trying to see what kind of sauces or whatever they have.
Yeah. I'm just saying whatever you feel safer with or better. I'm good.
I mean, this place is like a mezzy, so it's.
Hi, this is Mark Sharonchuk with the Dispatch. Can you hear me?
Yes, Mark.
Okay. 2 questions. How many people are going to be housed in a shelter immediately? And also, what type of facility is it? Is it a hotel, a motel, a college dorm?
Michelle, do you want to take that question?
Absolutely. Mark, thanks for that question. What we anticipate in terms of the people that are going to be concentrated from our current shelter array, we'll need 600 additional beds to do that. Right now, we have two open, and we'll continue to open all the way up to we have 6 open. I'm getting feedback, so I'm not sure if you guys can hear me.
I'm getting feedback. I can't hear it. Yeah.
Yeah, folks need to mute your lines. If you haven't done that, go ahead and mute yours. And then, Mark, for the folks that are going to be COVID positive or quarantined because they've been exposed, we are, our analysis says about 372 people at the height of the pandemic are
Turn down your computer.
that kind of service. We're going to be using facilities, hotel, motel. We may be using college dorms, also congregate
Excuse me, Michelle, could I ask everybody to mute their phones so that we have a better chance of hearing Michelle and her response here?
Wait. Okay, I saved it. Did it happen? If you go to images.
So
Everybody could mute their phone. I think we'd have a much better chance of hearing Michelle's response and questions moving forward.
okay, so on the shelters for isolation and quarantine, we believe there'll be from our data analysis at the height of the pandemic about 132 that will need that service. And as I said, we'll be opening in hotels, motels. We may use college dorms and also congregate settings like recreation centers and other congregate type settings. Does that help, Mark? Were you able to get that through all that noise?
If you can, because all I got was feedback, I hate to ask you to start from the beginning, but if you could say again,
okay,
how many residents and also where they're going to be housed immediately, and I'll mute them.
Okay, great. So the number of residents in total that we believe from what we've done with our data analysis that are going to need deconcentration, meaning the social distancing type shelters, are 600 to get everybody far enough apart. That's also accounting for folks that are becoming newly homeless because they're losing their current housing, and it's becoming more and more difficult for us to exit people into housing because landlords are a little reticent at times to have people in their units newly. On the folks that are going to need isolation and quarantine because they're either COVID positive or have symptoms or they've been exposed in the height of the pandemic, about 372 people is what we're predicting will need that. The first shelter that we're opening is in a hotel that we have taken over completely. And going forward, we will be using various kinds of different facilities, which could include college dormitories, recreation centers, and other kinds of congregate and separate settings.
Thank you, Michelle. Any other questions from the media? If you are on a cell phone and want to ask a question, you need to press *6 before asking your question if you've joined us just by cell.
Yeah, this is Mark again. So again, the number of people in isolation who need to be quarantined because they either tested positive or been exposed to people with coronavirus, that's 370?
Yes, we predict there'll be 372 individuals, or I should say households, that are going to need isolation or quarantine at the height of the pandemic. And so That doesn't mean that's the total that are going to experience that. What I'm telling you is that's the number who, at the height of this pandemic, we're going to need 372 places, beds or units where we can give those folks the isolation and quarantine services that they need.
And
How
I
many
think
people have tested positive so far?
At this point, what we are looking at from reports from the hospitals on COVID positive testing is we've got about 15 individuals who are either testing positive under investigation because they've been tested or are exhibiting symptoms that medical personnel are deeming a presumptive COVID positive.
How many people will be moving into the hotel immediately?
That we do not know yet, Mark. It's going to depend on who's ready. There are folks we know that are at hospitals that are awaiting discharge. So we really just do not quite know the number who are going to be needing isolation or the number to be needing quarantine. And I do want to say we are building out this systemic response so that we can be absolutely flexible because we have never done this. None of us have been under this kind of a pandemic before. And so what we're building out is a flexible way to respond so that if we need more for isolation or more for quarantine, we can provide that and we can move quickly and nimbly. And we're doing that with all this partnership. It's making it possible.
So is the city's fund helping to pay for this hotel space, correct?
We are using dollars that the city has allowed us to use in a flexible way. And so they are helping us with funding from this. We're also using, we'll be using some private dollars. We have asked everyone who is a donor to Community Shelter Board to step up and make an additional donation, whether you're an individual, a foundation, or a corporate partner. And we're asking those who've never gotten involved with us before to also step up and invest. We're really going to need every single member of this community to do their part, and whether that means volunteer and or invest, to get involved, because that's how we're going to get ahead of this.
Michelle raises a great point in response, Marcus. The city's seed funding with the investment that council made is going to help us get this started. But I'm seeking, and the Shelter Board and other partners are seeking resources from the county, the state, the federal government, as well as private and philanthropic leaders in the community as well. We know that based on what Michelle outlined to us, not just on COVID-19 positive, but folks with symptoms, their needs over the next couple of months, but also just a growing number of folks presenting themselves to the shelter system, because in the environment that we're in the crisis we're in, there are many folks, not because of evictions, because as everybody knows, those have been stopped for the next 8 weeks and no longer set out's going to take place. But for folks, and I'll let Michelle speak to this, there are a lot more folks presenting to the system that might have been living with friends or family members or couch surfing that all of a sudden, based on this crisis, have lost that temporary shelter and are presenting to the system now. So we know this is going to be an even greater need in the weeks and months ahead. Michelle, do you want to touch on that just quickly, the increase for shelter that's coming to the system now that's different than maybe what we've seen more recently?
Absolutely. We're seeing already many people who are showing up at our first deconcentration social distancing shelter. We had upwards of 40 or 50 men who came in who had not been homeless before. They were new to homelessness, and what they were sharing with us is that they've been precariously housed. They've been staying with their aunt or their cousin or their friend, and because people are concerned about that, they're asking them to move on. And they don't have a place to move on to. And so they end up in our homeless shelter. And we do know that that's just the beginning of probably this happening, because as people begin to fall ill, they may be asked to move on by family members, or they may want to leave because they have family or friends they're staying with that are ill.
Thank you, Michelle. Any other questions from the media?
Just so it's clear, too, can you say what part of town this hotel is in?
This hotel is towards the north end of town.
Okay. All right. And again, you said that you're trying to get additional space. So at the height of this, you're expecting to house up to 372 households?
Yes, we anticipate the number of households that will need isolation and quarantine at the top of the pandemic will be 372 households.
Okay. Is that part of the 600
No.
that you mentioned as well? Okay, that's different.
The 600 is just the folks that will be in the social distancing shelters so that we can get people far enough apart so that we are maintaining the right kind of spacing in the shelter array.
All right. And the social distancing shelters include the Y, correct?
The Y is the YMCA is our partner both in standing up the shelters for isolation and quarantine, as well as standing up the shelters to deconcentrate populations in the shelter.
Right. Okay. All right. How many social distancing shelters do you have?
Right now, we have one social distancing shelter. We anticipate we will have to open up at least one more and likely another after that, so a total of 3, because we have about 600 folks that are going to need to use those.
Right. And the downtown YMCA is one of those, correct?
That's correct.
All right. Thank you.
Any other questions from the media? You could just introduce yourself and your news organization.
Mark Zarenchik with the Dispatch.
Well, if there aren't any other questions from the press, appreciate everybody joining us here today. And again, want to thank all of our incredible partners that have worked on this. Council President Hardin, Michelle Heritage from the Shelter Board, Tony Collins from the YMCA, Dr. Mashika Roberts, Joe Mazzola, and Matt Habash. Appreciate everybody's continued partnership. One of the things that you really discover in a time of crisis is what your community is made of. And certainly coming together as quickly, as robustly, and as comprehensively as we have to serve our most vulnerable neighbors, I think is a good example that collaboration, that partnership, that public-private partnerships are incredible muscle memory for communities like ours, particularly in a time of crisis. So I want to thank everybody and look forward to continuing to share more information with the press and the public in the days and weeks ahead. Have a good day, everybody.
Thank you, Mayor.